how's everybody doing today?
Pretty good, how are you?
Great, thank you. I heard Mrs. C is in the emergency room and we're going to take a look at her. Can you tell me something about what's going on?
Well, sure. Mrs. C is a 42-year-old white female who presented with a report of fatigue and itching. She says that about a week ago she had the stomach flu for 4 to 5 days with some vomiting, diarrhea, and some muscle aches. Now, even though most of her symptoms have gone away over the past few days, she still has fatigue, loss of appetite, and some generalized itching.
What about her past medical history?
She has a history of type 2 diabetes with nephropathy. I also found that her baseline serum creatinine is 1.6. She has hypertension, paroxysmal atrial fibrillation, and allergic rhinitis.
Okay.
She doesn't have any drug allergies. Her father is deceased, but he had a history of CAD, hypertension, and diabetes. Her mother is also deceased, but she had a history of stroke, diabetes, and osteoporosis. The patient also has 3 children. All of them have diabetes and hypertension. Her home medications listed on the ED intake sheet are digoxin, atenolol, metformin, rosiglitazone, a lisinopril hydrochlorothiazide combination, and loratadine. The pharmacy student's working on the medication history, and he's just checking the dosages and making sure that nothing's missing.
Okay, what are her current vital signs and anything important on physical exam?
Well, her heart rate was 98, her respiratory rate was 16, her blood pressure was 104/70, temperature is 37.4 degrees Celsius, her oxygen saturation is 98% on 2 liters. Now, in general, she's ill-appearing, but she doesn't have any acute distress. Her mucous membranes are dry. She's currently having a regular rate and rhythm. No murmurs, no rubs. She has 2+ radial and dorsal pedal pulses bilaterally. Her lungs are clear. Abdomen's benign. She has 2+ pitting edema to her knees. She's lethargic, mildly confused, but she doesn't have any focal neurologic deficits.
Do we have any of the test results back, or are they still pending?
Most of her labs are all pending, except she does have a finger stick blood glucose of 198, and her EKG showed a sinus rhythm at 98 beats per minute. She also had some peak T waves, but no ischemic ST and T wave changes.
I see. Good job.
Thanks.